So this is a loading technique to the back part of the hip or the butt area, covering right where the belt would be, down right in through here. So you're covering this side, either the left or right side. You're going to need a ball and a platform to place the ball on top of and sit. There's two different methods that you can try. The first method is a seek and destroy. So I'm going to place the ball right into that butt area or into the target tissue. I'm going to scan, so I'm starting a little bit lower on my thigh and just trying to scan towards my belt line. And once I feel a sensitive area, I'm going to hold it. I feel it right about there, so I'm going to hold that position. The next thing I can do is kind of slightly swivel my leg inward or swivel it outward. Notice my knee is bent roughly about a 90 degree while I'm doing this effort. So I feel it more right here. So since I feel it right there, I'm going to lock it on top of the opposite shin. I'm going to hold that position, and then from there I'm going to take a deep breath in and exhale and just try to add a little bit more weight into the ball until my tush or until the tissues melt right over on top of the ball and it desensitizes that area. That's destroying that area. And then after that occurs, then I can progress to the next spot. I'm going to find an area that's sensitive, hold that position, slowly swivel my bent knee inward or outward. Once I feel a good position or good sensitivity, I'm going to hold that there, lock my knee down, take a breath in, exhale, and add a little bit more weight on top of the ball until it desensitizes. Now the second technique that you can do is more of the pin and stretch. So you're going to do the exact same thing, place the ball on the target area. You're going to scan that area first, so I'm going forward, and then I'm going back. I'm trying to find that area, which is sensitive. From there, I'm going to swivel this knee in or out until I feel more load or more sensitivity. I feel more sensitivity when I bring that leg inward, and then I'm going to lock that down just like that. From here, what I'm going to do is try to bring this knee straight up towards my chest. So I'm applying pressure, pinning that tissue down, and then I'm going to stretch it out by bringing my knee up towards my chest while I'm still adding that pressure. And then I'm going to hold that. Once it melts, then you can repeat, finding another spot.